All right, I think we're going to get started then. So hello and welcome everyone to the Atlantic Council for International Cooperation's 2021 Symposium titled From Obstacles to Opportunities, Harnessing the Momentum from a Global Pandemic to Inspire a More Resilient and Just Future. My name is Jennifer Sloot and I'm the Executive Director of ACIC. I'd like to take this opportunity to acknowledge Treaty 1752. I'm a white settler. I live and benefit from the unceded and unsurrendered territory of the Mi'kmaq. By living here, I am bound to support and uphold the treaties of 1752, and I stand with our province's Indigenous people. I'd like to start off our program, I'd like to welcome Mi'kmaq Elder Chief Sidney Peters. Chief Peters is from Glooscap First Nation and is the son of former Chief Joseph Peters. Prior to his election in 2012, he worked with the Confederacy of Mainland Mi'kmaq as the manager of their Lands, Environment, and Natural Resources Department. Chief Peters also has 23 years of work experience with not-for-profit groups, band councils, tribal councils, municipalities, and federal and provincial governments. As a special note, I'd like to tell you that Chief Peters is the father of an ACIC staff member, Josie Peters, and joins us from Glooscap First Nation, where our colleague Jordan Smith resides. We're grateful to have an elder with these personal connections join us today and to say a few words. Thank you, Chief Peters, for joining us today, and I turn it over to you.
Hey, thank you very much for that introduction. I just wanted to say good afternoon, everyone, and it's an honor for me to be able to join you virtually today and welcome you, of course, to the Atlantic Canada for the International Cooperation Symposium. Of course, as you know, that your main theme of the symposium is to explore how COVID-19 has impacted our lives, both as individuals and collectively as members of the international cooperation community. I can honestly say this pandemic has not only caused many challenges, pressures, and strains on our communities, businesses, our health system, our education system, but it has also had a great impacts on us as individuals and families. COVID-19 has required us to do things differently. We have had to adapt. We have had to be innovative, not only with the way we work, the way we do business, but managing our day-to-day personal lives and relationships. Tough decisions had to be made. Of course, priorities had to be identified. From the perspective of our community of Glooscap, our own source revenues was drastically reduced due to many of our businesses having less foot traffic or even having to completely close. This revenue is something we rely on to provide much needed programs and services to our band members. It was a difficult time and required, again, as I mentioned, difficult decisions and sacrifices had to be made. I am pleased to say that we got through these challenges together. A lot of times is our community members think that Chief and Council, you need to help us out as much as you can. And of course, they depend on a lot of the governance of the day to overcome these situations. So as we talk about, along with these challenges came valuable lessons for things as small as how we can work from our home and the job still gets done. Maybe we don't need to travel to meetings as much, know that we have things like Zoom, to the bigger things such as keeping in touch with families and loved ones more of a priority, as well as our physical and mental health. We all are pretty well familiar now with Zoom and Teams and how that process will work. I must say, being a chief, it's kind of nice at some of the chiefs meetings that this is through Zoom. One thing about it, we only usually have one individual talking at a time. So it's kind of nice. It's like going to a meeting in a circle where you have a talking stick. But here, I guess it's more of a computer in a way that we use. So you only get one conversation going on at a time. So I just wanted to say, of course, as we move forward, we still have a sense of uncertainty. We do not know what life's someday, that life will be back to what it was, and someday, hopefully, to the same as it used to be. But of course, it won't be the same. We just have to get used to the new norms of the day. I hope that over the next 2 days, you have an opportunity to discuss how we will move forward and how we can incorporate lessons learned to make the new norm even better than before. So again, I just want to thank you for the opportunity for me to welcome you to your symposium, and I just want to wish you all the best over the next few days. I know how important this symposium is, and how important you understand that how the pandemic has impacted us worldwide. And it's something that's, again, as I mentioned earlier, is the new norm, and how do we adjust to that, whether it's mentally or even physically in some cases. But I just wanted to say thank you for allowing me to be here, and wish you all the best in your next 2 days. So, well, Alio, thank you.
Thank you so much, Chief Peters. That was beautiful. Before we get started, I'd like to note that we're located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. I'd also like to take this time to acknowledge that I'm in Shipuktuk. I would invite you to add to the chat box the land that you're in if you know it, and Roshni is going to put a link in there if you don't know it, so you can find out and note it in the chat box. So it's my great pleasure to welcome you all to ACIC's annual symposium. The pandemic has had a deep impact on the lives of people all over the world, and in some countries more than others. It is time to form collaborative efforts and tackle the challenges as we emerge from the pandemic. For those who are not part of our network, the Atlantic Council for International Cooperation is a coalition of individuals, organizations, and institutions working in the Atlantic region to build and model just, equitable, and sustainable communities locally and globally. ACIC connects leadership across generations by strengthening members and partners, bridging dialogue, and building networking and learning opportunities. ACIC also represents and amplifies the voice of Atlantic Canada and connects the Atlantic with other provincial, national, and international stakeholders. Hence, I would also like to emphasize ACIC's solidarity towards the conflicts and challenges that are being encountered in various parts of the world, namely in the Democratic Republic of the Congo, where the statistics reflect persistent volatility now in its fourth decade of a major humanitarian crisis. On top of the large-scale violence, Congo has also had to grapple with the outbreaks of Ebola and COVID-19. This year has also marked the decade-long conflict in Syria as violence, displacement, and humanitarian needs continue to grow. Syria is still dealing with the decimated economy and inadequate health systems, which further destabilizes the ability of Syrians to cope with the challenges of COVID-19. We at ACIC strongly condemn the current unconstitutional military takeover in Sudan, and we stand in solidarity with the people of Sudan and their hopes of a just and democratic future. Furthermore, this year also saw Haiti in a series of sporadic national disasters, gang violence, and a long-standing political tragedy leading up to the assassination of political leaders and displacing civilians. We at ACIC condemn such atrocities and stand in solidarity with the innocent civilians of Haitians. As part of our work to strengthen the effectiveness of ACIC members and partners, we work to provide opportunities and space for peer learning. The aim of this symposium is to strengthen individual and collective capacity and highlight and celebrate important work being done in the Atlantic region and around the globe. It facilitates dialogue and makes connections between issues and the actions necessary to create sustainable and just futures, both locally and globally. Participants here today include international cooperation practitioners, youth, Indigenous leaders, local government representatives, feminists, environmentalists, issue-specific experts, advocates, and academics. We're thrilled that this year our discussions will be enriched by the representation of people from within Atlantic provinces, other provinces in Canada, and outside of Canada as well. joining us from different time zones and representing all embracing age groups, cultural and diverse groups. I'd also like to extend a warm welcome to those joining from the youth stream, which has involved 12 youth from Atlantic Canada, ages 18 to 25, who are joining us throughout the symposium. We know that youth play a vital role in the pandemic recovery, and we welcome your input into the program. Now a little bit about what's to come this afternoon and tomorrow. I'd like to note that ACIC's annual symposium has been co-created with ACIC members who have devoted their time over the last many months alongside the ACIC staff team to develop an interactive program that provides space for dialogue, learning, and collaborative planning to turn ideas and projects into action. A special thank you to ACIC members, including Della Webster, Leo Chevry, Leela Berryman, Emily Chason, Haruka Ayoma, Diane Climentage, and Kaylee Wong for their efforts in making this event a success. We'd also like to thank Global Affairs Canada for their continued support and encouragement. This year's theme is focused on the Sustainable Development Goals, and in particular SDG number 10, reducing inequalities. We know that the impacts of the pandemic are wide and far-reaching, but they are also exacerbating the inequalities that were already present around the globe. COVID-19 is not only challenging the global health systems, but testing our common humanity. It affects everyone, everywhere, yet it hits the poorest and most vulnerable communities the hardest, deepening in existing inequalities. And at the same time, social, political, and economic inequalities are amplifying the impacts of the pandemic. Inequalities are also deepening for vulnerable populations in countries with weaker health systems and those facing existing humanitarian crises, some of those which I noted earlier. Refugees and migrants, as well as Indigenous peoples, older persons, people with disabilities, and children are particularly at risk of being left behind. Hate speech is targeting vulnerable, speech that targets vulnerable groups is also rising. This time of crisis must also be used as an opportunity to invest in policies and institutions that can turn the tide on inequality. Leveraging a moment when policies and social norms may be more malleable than during normal times, bold steps that address the inequalities that the crisis has laid bare can steer the world back on track through a just recovery. During the pandemic, many change makers and activists have brought attention to the stories and realities that touch on the various impacts of COVID-19, creating an opportunity for change around the world. Catapulting on this and ensuring that we don't lose momentum, our panelists today will highlight various aspects of issues faced in our local and global communities. Throughout 4 panels over the next 2 days, we will draw parallels to past crises and the global turning points they ushered in as the world begins to look to the future. Our panelists from around the world have convened here to hold discussions that speak justice and equality. Our first 2 panels today, later this afternoon, will highlight the impact of COVID-19 on historically underrepresented and systemically excluded communities. We will address some of the implications of COVID-19 and note how crises offer opportunities for change. Our panels will be discussing the gaps shown and exacerbated by COVID-19 and the creative solutions that are already in action that can help create a better future. Tomorrow, we have our keynote panel moderated by Canadian Army reservist and youth activist Kaylee Wong and featuring ActionAid Bangladesh's country director Farah Kabir and Bolivian feminist and co-founder of JASI Renihe Noli Guzman, and they will ask how social movements can be mobilized into institutionalized policy changes and how to bring about long and lasting transformative change in society. The panelists will focus on the way in which small, medium, and large-scale social movements translate into policy changes, how the pandemic has impacted the way we mobilize around social issues and implement changes, and critically, what a post-pandemic just recovery looks like and how to adopt collaborative and intersectional practices to create positive social change post-pandemic. Rounding up the symposium will be a pro-action cafe designed to help the participants move calls, ideas, and projects into action with tangible plans aimed at driving individual and organizational goals forward. The keynote panel will act as a precursor to the ProAction Cafe, where all participants will harness their knowledge and understandings into a constructive discussion of the building of a post-pandemic world and all the different ways that the pandemic has impacted our lives on an institutional level. The ProAction Cafe will tackle some essential questions such as, how do we go about making big change happen? Where do we start to cultivate meaningful ideas of change? How do we move forward from a global pandemic to inspire a more resilient and just future? I'm so eager to hear the perspectives of these diverse speakers and to hear from those of us that are here today and tomorrow, joining from Atlantic Canada and around the globe. We look forward to deep discussion and reflection and hope that over the next 2 days we can learn together. A special note, as we're hosting the symposium over the next 2 days, we will be offering a door prize at the end of the session tomorrow, the ProAction Cafe, which includes a gift basket of local and fair trade goods. So we encourage you to attend as many events as you can, and in particular, the ProAction Cafe tomorrow. As a reminder, we will be recording the panels and we'll email the recordings out to all registrants next week. If you want to interact and ask questions with panelists, you can use the chat box. You can also use the chat box to say hi to each other and introduce yourself. I'd encourage everyone to ensure that your name is up to date on your Zoom profile, and Roshni will include some instructions on how to do that in the chat box if you don't know. And finally, a gentle reminder that ACIC stands for Respect, Inclusion, Equity, Humility, Safety, and Solidarity. We will not tolerate any communication or behavior opposed to these. Please keep all of these in mind when interacting with each other in the chat box, in breakout rooms, and on social media channels. So, about the first panel, the title is The Impact of COVID-19, and it will shed light on the diverse and complex realities exacerbated by the pandemic faced by communities locally and globally. There'll be an opportunity for questions at the end, so if you have questions throughout the conversation, please post them in our chat and we will compile them for discussion at the end of the panel discussion. The panel is moderated by Dr. John Cameron, Associate Professor of International Development Studies at Dalhousie University and a past board member of ACIC. With that, I'll turn it over to you, John.
Great. Thank you very much, Jennifer, for the introduction, and thank you to ACIC for hosting, and it's great to see so many people on the Zoom meeting. I have the pleasure of hosting this panel on the impacts of COVID-19. Hopefully they join in soon, and we can have the full panel. I'll start out by introducing everyone and then start the discussion with those who are here. So of those who are here, and I'll ask you, if you are one of the panelists, if you can turn on your video just so we can see each other and so the panelists, the participants can see you. Our first panelist is Madhu Verma. Madhu is one of Fredericton's earliest Indian immigrants. She arrived in Fredericton in 1963 and immediately became a very active community volunteer and social activist. Since 1964, she served on the boards of multiple local, provincial, and national organizations, and she's helped to organize numerous conferences and workshops. She's presented and written policy briefs on issues as diverse as immigration and refugee policies, immigrant women's issues, domestic violence, international arranged marriages, anti-racism, intercultural and human rights education, employment equity, the list goes on. In 2001, Madhu was a Canadian delegate at the UN World Conference Against Racism, and she's currently the founding chair of the Asian Heritage Society of New Brunswick, a founding member of the New Brunswick Multiculturalism Council, the Multicultural Association of Fredericton, and a member of the New Brunswick Council in addition to many other committees and groups. So a long history of deep engagement in New Brunswick. Briana Miller, who I see has also joined us. Thank you, Briana. Briana is passionate about social justice issues and engaging people in collaborative conversations to create and foster social and systemic change. She has worked with newcomers over the past 7 years, and in her current work, she advocates and supports service providers to be more culturally informed in their work, primarily related to the prevention of gender-based violence with newcomers. Briana was also part of initiating and supporting the launch of the Supporting Queer Newcomers Committee at the YMCA Center for Immigrant Programs. Our third panel member is Luvasua Razafindravoni. And Luvasua, I hope I'm pronouncing your name properly. Sounds like I'm close. Motivated from a young age by her passion for nature, Luvasua studied biology at university and dreamed that she'd be able to use that scientific knowledge to help other people. She now feels proud to have the opportunity to live this dream, working in the middle of the Ranomafana rainforest, working with the organization Centers Valbio and the local Tanala and Betsileo communities since October 2015. Luvasua has also been able to see firsthand through her work how education can open people's eyes to the importance of biodiversity. Our fourth panel member, who we're hoping will join us soon, is Stacey Gomez. Stacey is a community organizer very active in the migrant justice movement, primarily with known as Illegal in Halifax, Jabutug, as well as the Halifax Jabutug Migrant Workers Program. That program engages in outreach, accompaniment, public education, and advocacy in solidarity with migrant workers in Nova Scotia. And so far this year, the program has provided support to over 1,300 migrant workers throughout the province. Stacey is also a member of the Migrant Worker Rights Working Group in Nova Scotia. So we hope she'll join us shortly, and we'll encourage her to turn on her video so you can see her join the panel when she's here. So we have a very accomplished and experienced group of panelists from a diverse range of backgrounds. And the goal of this panel is to better understand the impacts of COVID-19 in the communities that you work with, as well as both future risks and future opportunities, if there are any. So I'm going to start out with, I've had a number of questions. I am going to channel my best inner Oprah Winfrey talk show host and try and keep my questions short and clear. And I'll also ask the panelists to try and keep your responses short and clear so that we have time to hear from each other, and also so that if people in the audience, the participants, want to ask questions, you can do that in the chat. We will monitor the questions in the chat and certainly come to those in the end. But if anyone who's listening has a direct follow-up question, please feel free to put it into the chat, and I will do my best to interject and try to get to the participants to follow up directly. We don't always have to wait till the end, but it may be that some of those questions I don't see, or I'm not able to get them in until the end of the session. So I want to start out with a broad question for all the panelists, and maybe just as a warning, I'll start, Madhu, with you. The question is, how is the COVID pandemic exacerbated inequalities and inequities in your community and the work that you do? Start with that one, Madhu.
Hello. Well, thank you very much for offering me the opportunity to speak on this very special symposium. One thing what I see, that we have united the whole world, and this either is a problems or whatever we are facing, we are all together because it's affecting everybody. whether we are in the east or west or north or south. So this is the one thing we see. And some of course, they are scientists, they are busy finding some kind of cure or some kind of vaccine, or in their lab, they are working very hard to protect us. And on other side, we see the people who don't get the facility or can't afford to have this vaccine. So this is a one thing. So we are whole in a way, the world is facing the similar problems. Some are finding the way, other they want our help to help them. So in a way, in the small community, what we see in the New Brunswick, we have a university students. So some of the students, they are coming the first time to Canada to study here. So they were put in a very difficult situation because they could not travel. So if they found the flights, it was the first difficult step to find. When they found, they have to have thousands of dollars to spend for first to stay in 3 days in the hotel. That was costing again, then 14-day in isolation. That we came to the new country, the new city, a new atmosphere. They didn't know how to handle it. 14 days, they couldn't even see where to order the food. They're costing so much money to the parents. They were not prepared to have. One thing is their traveling cost was very high, then 15 days in isolation, then when you enter, you have to pay in the 3 days in the hotel. So this was something is a very different and very difficult. And then of course the online courses, uh, especially for the new students. And I see a lot of new immigrants who are that we were providing them the service teaching English, and they were also got stuck with the new system, which they did not know. And again, in the child care, that was very important. Some of the working people or some of the students, so they didn't know what to do. So the children and the parents in the same room, so going through the same situation, how to deal with it. I think this was another issue what we have as a multicultural association, the settlement agencies and Asian Heritage Society. There were a lot of questions coming to us. So how to answer that?
Great. Briana, I want to go over to you next because you also work with newcomers. Are there any differences or any other issues that you would highlight in the communities that you work with?
Yeah, so I work at the YMCA Center for Immigrant Programs, and similar to what she was saying as well, but we also noticed that it was really difficult for a lot of the people we work with because there was just a lot more isolation. A lot of the people we work with, they're still new, they're still figuring out supports and services. A lot of those supports and services are their main contact of people and information. And so when physical doors were closed, some of them didn't know how to connect with, to figure out what was happening, as well as the information around COVID was being put out very quickly. It wasn't often translated and it was changing day to day. So a lot of our clients were very confused, didn't know what was happening, the loss of jobs, they didn't understand CERB. And so again, this put a lot of strain on families. So we did notice that with our clients, just the increase, all the challenges they were already experiencing with settlement, all of a sudden it became even more difficult. And again, it became even more, the language barriers, the lack of understanding the supports and services, all of those just became increased during that time. So we definitely noticed these things as well.
Great. And I also want to take the chance now to welcome Stacey Gomez. Stacey, I introduced you before you joined onto the call, so you'll have to hope that I introduced you appropriately, but welcome to the panel. I want to go to you next, as you also work with migrants and newcomers. Are there any particular inequalities and inequities that you've seen that community grappling with?
Thank you, and it's good to be here. Hi, everyone. Yes, I would say definitely COVID-19 has hit migrants very hard. We know that migrants feed the world, and that includes migrant workers, but also undocumented people like working in restaurants. Like, it's quite broad, the way that migrants contribute to our food system. And yet during the pandemic, we've seen that increased vulnerability has had such a negative impact on this community. So for example, there have been thousands of migrant workers throughout the country who have become ill with COVID-19, a number who have died from COVID-19. And this stems from longstanding issues, including poor, inadequate and overcrowded housing. And even, I know we often hear about these issues in other parts of the country, but also here in Nova Scotia, we know that just a few years ago, there was reports that Mexican farm workers were reporting to their labor ministry when they returned home. Almost 100 of them reported about decrepit housing in Nova Scotia, overcrowded housing in Nova Scotia, not having like the basics in their home here in Nova Scotia, working on Nova Scotia farms. So that's one thing. Definitely, I would echo around the isolation. That's something that we've seen, increased isolation of workers. There have been workers who have been told that they're not able to leave the farm during the pandemic, but these are also issues we know that pre-exist COVID-19, but have been made even worse by COVID-19. Because, for example, we've seen like workers being subjected to heavy surveillance in their workplace, getting in trouble if they talk to Canadians, but also this has been increased during the pandemic with the, you know, definitely there are legitimate public health orders that have been put in place, but also, you know, when workers are in a situation of abuse, they're not actually being, this information is sometimes not being shared with them about what are the protocols that are in place. And sometimes it's just even beyond the protocols that are in place that are a violation of their human rights. So these are some of the things that we've seen. And also, I can talk a bit more about it after, but, you know, we've seen the Nova Scotia government rely heavily on employers for migrant workers to be able to access the vaccine. And this has meant we've seen a few different things, you know, workers being threatened that they would be sent home and fired, not be able to return on the seasonal agricultural worker program if they didn't get the vaccine. But alternately, we've also seen employers who have, you know, workers are working for them who want to get the vaccine, but they've deprioritized it. And it's so hard for workers to get access directly for themselves. So these are some of the issues that we've seen that have really just worsened during COVID, and definitely increased xenophobia, increased racism against migrant workers in the communities where they live and work and have lived and work. Some up to 30 years have been coming to this country, but experiencing racism and, you know, being seen as a threat in the context of the pandemic. So yeah, these are some of the issues that we've seen.
Thanks, Stacey. I'm wondering, especially, and Louis, who I want to come to you in a moment, but because the first three panelists all work with newcomers and migrants in the Maritimes, I want to follow up on that theme first. You've talked about all three of you have talked about the issues that our migrants and newcomers are grappling with in the context of COVID-19. I'm wondering if you can tell us how, from your experience, how they've managed these stresses and challenges. So we've got the challenges are kind of an objective, I guess, description, but in terms of capacity to respond, to manage these stresses, how are people coping, and what are some of the, I guess, the impacts of the additional stress? Maybe Briana, I'll start with you.
Yeah, sure. That's a great question. So I think it depends on who and the supports and services. A lot of our clients, you often saw a lot of like groups organizing to support each other that happened to fill that gap of like supports and services. I know a lot of so a lot of newcomers were actually trying to support each other, trying to translate things, get information out. You saw a lot of Facebook groups being created and kind of this community of care, as well as like organizations like ourselves suddenly had to be change entirely our services and supports to try to also mitigate these gaps and to try to reach out more. But one of the things that I do want to mention is the impact that this can have is that when, you know, as Stacey was also mentioning, just like even like the work stress and the access to things and isolation, all these things can impact families a lot. And as I mentioned, when we already know that a lot of newcomers are dealing with the settlement challenges as is, COVID just added so much stress onto families that we know, and this is not exclusive to newcomers, I do want to recognize, but we know that gender-based violence globally and in Canada too increased during the pandemic, because we know that, you know, the contributing factors of violence, these are the same things like financial strain, isolation, lack of supports and services, lack of support systems, and things like that. So people who are already vulnerable to being victims of violence, which included newcomers within that category, as well as African Nova Scotians, Indigenous populations, LGBTQ, and many, many more, because of the systemic challenges, they were at a higher risk because, you know, again, it was even more difficult to reach out for help, and they didn't know where the supports and services are. Many of those supports for, you know, gender-based violence, they turned online or on the phone, and again, it's already difficult for anyone, even who speaks English, to access that if they're living potentially with an abuser, but let alone someone who even the language is hard, and there's that additional layer of fear of reaching out and the unknown of what happens if they reach out. So, you know, I do want to again emphasize that gender-based violence happens across all demographics. It's not exclusive to any kind of type of person, but there are groups that are at a higher risk, and it's because of colonization and systemic oppression and racism, all these different factors. So we did notice, like even at our center, increased support from our mobile crisis workers around domestic violence and family violence and things like that. But when you think of the stress that COVID-19 puts on families and the isolation and things like that, it does put people at a higher risk. And again, the supports and services within that sector alone is not even adequate without COVID-19. So this was something that we definitely noticed a huge risk for, and it was something we were really concerned about and constantly trying to work on.
Thank you. I also have a follow-up question for Madhu and Stacey as well. You've, as well as Briana, the three of you have spoken about the impacts of COVID-19 on the communities, the migrants and newcomer communities that you work with here in the Maritimes. I wonder if you're also hearing from people who have not been able to come to the Maritimes, so that communities of people who you would be working with in other contexts pre-COVID-19, who have not been able to travel to the Maritimes. So the migrant workers who haven't been able to come, the students who haven't been able to come, the members of immigrant families or new immigrants who have not been able to come to the Maritimes. I mean, these are people who in some ways are left out of the conversation because you're not working with them on a daily basis, but you would have been if it were not for COVID-19. I wonder what you've heard from them or what you've heard from their family members and their friends about how those people are grappling, people who may have been planning to move to Canada but have not been able to. Maybe Stacey, I'll start with you in the context of migrant workers.
Yes, thank you. And just to give a bit of context, there are about 1,500 migrant workers in the agriculture sector that come to Nova Scotia each year. In terms of the communities, primarily Jamaican and Mexican are the main demographics here in the province. And I would say one concern that workers have in being able to speak out is the risk of being fired, sent back to their home country, and not being able to return. Those are constant fears of not being able to return. So I would say, we continue to see that during the pandemic. There's still those fears of people in situations of abuse, I would say increased situations of abuse, still facing that fear. And there's not, right now, there's not a lot in place. So migrant workers are tied to one employer. That means that they don't have mobility. Like, as Canadians, we could leave our job. We could put forward a complaint, but for migrant workers, they actually only have authorization to work with that one specific employer. So that is a recipe for abuse. And so in order to leave, they have to make an application to get an open work permit for vulnerable workers. So imagine being in a situation of abuse and you have to make an application. You have to prove that you've been abused. And then only if that's accepted, then you have authorization to work elsewhere. So that's really puts workers in a very, very bad situation. So I just want to mention that, but these are constant, regular situations of vulnerability that migrant workers are in. But I would also say migrant workers pay into employment insurance, but they do not get access to employment insurance when they're, let's say the season ends, someone goes back home and they're unemployed. They cannot access employment insurance, even though they're paying into this. So what happens in this situation when we're in a global pandemic where, people are being told avoid non-essential travel, though work is essential. So, but, we're being told not to travel. But migrant workers, in order to take care of themselves and their families, are being forced to, they're forced to risk their lives and work here. And they're very essential workers for us, but really there is that element. And also there was some focus on, I think, Jamaican workers who were asked to sign kind of a document before they left, kind of saying that that there isn't any, that they're kind of making that decision and there's not a liability on the part of like their sending country if something happens to them in the context of the pandemic. So these are kind of, the risks that are there, that are inherent in the program. Definitely people have the decision to whether to come or not, but it's a difficult decision. They're, they don't have the supports if they were to stay home. If they chose to make that decision to stay home, they wouldn't have that income support.
Yeah. And Stacey, are you aware of migrant workers, for example, people who may have been coming to Nova Scotia or to work on other farms in the Maritimes, who've been coming repeatedly year after year and were not able to come because of COVID? Or was that an issue? Do you hear from those people? Do you know how, again, thinking about the migrant workers who perhaps could not come because of COVID, has that been a challenge?
I've more heard of workers who they have been, maybe their employers kind of did not send for for them earlier. They were sent to another part of the country. That's kind of what we've seen.
Thanks. And Madhu, what about you in the Fredericton and other parts of New Brunswick? You're very much engaged with a number of immigrant communities. What have you been hearing about and from people who have not, I mean, we've been talking about newcomers, but what about the people who haven't been able to come? What have you heard from and about them, and how COVID-19 has affected people who you normally would have been working with but have not been able to?
Well, one thing is a very important I want to share with you, because it happened with our own community and with my own family. The one thing was that I know my couple of friends, their husband passed away, and they have no kind of system or no flights coming even from Toronto to Fredericton or to Halifax, or they even could not attend even the funeral of their parents or in the family. And because my own husband, he passed away September 1st. And what I have dealt with, it was a very difficult moment when you want your family together. Children want to see their parents in this very difficult situation, and they were not able to travel. Finally, my son, I am telling you my own experience, my son and my daughter, one came from Montreal, one came from Toronto. And when they reached there, so they wanted to see their father in the hospital, and so much restrictions were there, they were not allowed to go there because they have to go get the vaccine. Now the test again, they had a vaccine, but still they have to go for the test again. And the clinic, what the province set up, it takes 3 days to get the result. You go and get the test in 3 days. They couldn't wait that many days. And then they have to pay, of course, $100 every time they come to go to the private clinic. So that was the only way, at least my children were doing, because you wait 3 days and after 7 days again, you have to get a test. So this is a ridiculous thing. We are traveling from one province to other. They had vaccine, they had the test, and still I don't know why we put in those conditions when the family is already suffering with a very kind of a stressful situation. So this is the one thing I really felt, and some other people also felt who were in the similar situation. They were not able to be with the family in their very difficult time of their life. The medical system was another problem, very serious patient of cancer or with the heart problem, or so they were not able to get, even they put them in the back seat when they wanted something immediately. So that is another big issue. The seniors, they were isolated. My husband, I was needed somebody because he went to in a depression. And I say, could I have to have some doctors or some social worker who could? No, I couldn't get it. That will appointment they will give after 6 months or a year or 2 years. So I think this is a big change in the life for whosoever dealt with that situation. But what I feel, I don't know, maybe when we are talking about the future or what do we do, one has to be prepared in that situation. We have to put everybody in a way together who are in that emergency situation. It's not to deal with one and leave to the other. How do we do it? How do we find the way to help? So I think this is another thing I really wanted to share with you, and especially in the what we heard in the senior home, care home, what was going on there is a terrible, but the treatment they were getting. Family could not see, the trained worker were not there to attend them at the time when they needed help. Medical care, I don't know how good it was because they were completely cut off from the system. So I think this, I feel it's a something I personally suffered. It was very difficult time.
Well, I'm very sorry to hear of the loss of your husband. I think on behalf of ACIC and all our participants, I want to share those condolences, and especially in the context of not being so difficult to have family come and visit. Luvasu, I'd like to go to you next. You've been very patient. We started out with a focus on newcomers, immigrants in the maritime provinces in Canada, but I'm sure everyone is very curious to hear about your experience in the context of COVID-19 where you are in the communities you're working with. Can you just start to maybe tell us how the pandemic has affected your work and the communities of people that you work with?
Sure. First of all, good morning, good afternoon, and good evening. If you have the same time zone as me, it is 7:50 here in Madagascar, and it's a pleasure for me to be with you all through this discussion panel. I also wanted to say that I represent my organization, which is Centre Valbio, a research station located in the eastern part of Madagascar, and is dedicated to research, conservation, and various community outreach programs such as health, reforestation, environmental education. Also, I wanted to share a little bit of context before answering your question about the impact of the pandemic, that Madagascar is amongst the least developed countries in Africa, with 77% of the population living in extreme poverty, with less than $1.25 per day. In addition to that, Madagascar is vulnerable to political crises, natural disaster, biodiversity threats. So you can easily guess that COVID-19 did not help, but even worsen the situation. And I'm going to mention few of the intensified problems caused by the COVID-19. In terms of tourism, for example, 1.5 million of people depends on tourism. The area where we operate is one of the most visited by tourists because we have a national park, and the pandemic caused economic difficulties to a lot of tourist guides, hotels, artists who represent an important part of the local community. One of the most basic challenge also for the country is facing a low level of education, which is related to lack of qualified teachers, appropriate infrastructures, access to education, and so on. And after a long period of lockdown, children had to stay home without appropriate education, including environmental education from our center. I know that in many countries, online class had been a solution for many schools and many children, but here in Madagascar, that is still out of the league for many families and schools. And finally, concerning conservation. Conservation has always been a challenge in Madagascar due to the vulnerabilities of the community that host a unique biodiversity. When revenues are no longer flowing, people don't have money to buy food, they don't have choice but to use the natural resources for meeting basic needs such as food, fuel, and shelter. So I think COVID-19 impacted a lot, and for instance, tourism, education, and conservation.
Luba, so I want to follow up, as you've told us, it's interesting. In Halifax, in Nova Scotia, when we hear in the news about the impacts of COVID, I think so many of us are used to tracking the daily case counts, the number of people with new COVID cases, the number of deaths, the number of people who have recovered. And so we often tend to think when you talk about impacts of COVID-19 are the immediate health impacts of how many people have COVID, how many people are vaccinated. What I find interesting is what you've been telling us about is primarily our secondary effects, or not the immediate health effects, but the impacts on tourism, on people's livelihoods, on their education. Not necessarily the first impacts, but unanticipated ones in some ways. Could you also tell us a little bit more about the direct impacts? Like, how many people do we know how many people have been infected by COVID-19? How is the healthcare system responding? Those kinds of things.
As far as I know, about 43,600 people were tested positive with COVID, and about 960 people unfortunately died. And the government did their best to ensure and to help to support people not only in the health system, but also economically as well, because there was some help support, social help and support that were given to the most vulnerable people. So personally, I am thankful to what the government had done. And in terms of the health system also, there was a system put in place to make tests and to be able to support also the people that was impacted. And very recently, the vaccination also arrived in our country, and people are getting vaccinated, especially the people in the communities where tourism is very important, like the community where we operate, for example. So they have been prioritized with the vaccination.
Thank you. I think it's, again, in your emphasis on the impacts of COVID-19 on tourism and therefore on people's livelihoods, on education, on the ability of people to run small businesses and to earn livelihoods. You're highlighting, they said, these kind of secondary impacts of COVID-19, which also highlight stresses, inequalities, inequities, some of which may have existed beforehand, and some of them may be new. I wanted to bring this question back to all the panelists, to Stacey, Briana, Madhu as well. I'm curious if there are, in your assessment, is COVID exposing new inequities and inequalities, or is it simply making inequalities and inequities that already existed, is it making them worse? Or are there new issues that we also need to be aware of that simply didn't exist pre-COVID? Maybe Stacey, I'll start with you in the case of migrant workers. Are there any new issues? Is COVID accentuating, kind of increasing the problems that migrant workers are challenged with, or are there new issues as well?
I would say that it's exacerbating issues that have already existed. For example, I mentioned around housing. Poor, decrepit, and overcrowded housing has been an issue for many years, but we know that with the pandemic, that people are at increased risk when they're in such spaces. Physical distancing is a protocol that helps ensure our collective safety, but that is not often respected for migrant workers in terms of the living conditions by their employers, because it's the employer's responsibility to provide housing for workers, but often they are still quite overcrowded, quite a large number of workers, and we've seen the impacts of that throughout the country. So that, and for example, like here in Nova Scotia, there is not public access to healthcare to everyone in the province. There are many migrants that do not have access to healthcare. And for example, talking about migrant workers come here up to 8 or 9 months of the year. They do not have access to our public healthcare system. What does this mean when we're talking about even like the vaccine, for example? So we know that unless you have a health card, you're not able to access the online system for booking vaccines. So that means that you have to call a phone line, but there's a long wait. And as if people have tried to get their vaccine receipts, we know that there's a long wait to get your vaccine receipts. I literally called within a 2-day period 100 times to request someone's vaccine receipt, or a number of people's vaccine receipts. So these are the inequities that migrant workers, migrants broadly, are facing within this context. And it's really, we should have public access to healthcare for everyone, but that's not the case in this province. Thank you.
Okay, mute button. Briana, what about you in the work that you do? Do you have a sense of whether COVID has been intensifying already existing inequalities and inequities, or are you also seeing new issues emerging that you simply hadn't experienced or seen pre-COVID?
Can you hear me? Just double checking.
Yes.
Yeah, okay. Yeah, I think no, it like a lot of these problems were already in existence, and I think that it's, you know, COVID-19 has just brought to light, I guess, many of these gaps, like things, you know, we noticed when even in an education system, we already know that a lot of our newcomers, they're, you know, struggling sometimes with going into schools after maybe gaps of education or things like that, and then being put online all of a sudden. So it puts a lot of self-learning and a lot on the families to try to navigate. So things like that we did notice, and again, like we already noticed that our like the families that we're working with, and again, most of the clients that we work with are government assisted refugees. So you know, we already noticed that, you know, the financial strain, the lack of supports and services that they're finding, and just like difficulties finding jobs and understanding the laws and things like that. So when COVID happened, yes, of course, we saw increases of the pre-existing challenges, you know, and again, like the strain that puts on families. But again, it also highlighted, I think, that a lot of organizations or supports and services maybe hadn't really thought about kind of the access to their supports and services, and how maybe inaccessible it was even before COVID. And then this just added more to that. So we did notice newcomers were struggling a lot, similar to lots of other demographics as well. And again, like it didn't help that we do know that racism and xenophobia already existed in Nova Scotia, but this didn't help. So COVID definitely added this layer of like people from away. You know, there was a lot more hate towards people. Racism was definitely like on the rise. And that didn't help when it came to wanting to access more supports and services. So if people were experiencing challenges, a lot of our clients may mistrust a lot of services and supports. They may have anxieties around accessing the health system, or justifiable fears of authority or police and justice systems. And so during COVID, you know, if someone was in trouble or they needed support, there was like less likely to reach out. So, you know, for example, if there was domestic violence situations, there would be a fear, and I know Stacey kind of alluded to this, the fear of deportation and then leaving the country. That was a big fear even in like domestic violence situations. We know that perpetrators often talk about this like myth of like, well, if you report me, we're going to get deported, or you're going to get deported, and things like that. So this fear of the unknown was really hard. But the other thing I do want to, I guess something that was highlighted during COVID, again, was like mental health around, particularly refugee mental health. It is still a huge gap. And I think, like, you know, when people are isolated, and the mental health impacts of COVID affects everyone. But on top of it, if you're already experiencing maybe trauma from before, trauma from the settlement process, this doesn't like help. And there wasn't a lot of mention about kind of that around like settlements. You know, a lot of our settlement services are connecting to community, a lot of recreational support, and it's not just for fun. It's part of like mental health and community connections and building supports, which we know support families to be healthier and happier. So we, you know, things like that were also important. And I did want to just mention one thing you had said about the impacts COVID had on some of our clients. The fear and unknown of like how family members are doing overseas, that also is like very stressful. You know, COVID was impacting different countries in different ways. You know, and there was like situations of, you know, increased mortality and things. And at the same time, as you were mentioning at the beginning, conflicts and different things didn't pause during COVID. And so, you know, while they're still trying to navigate the situation here, I think there's also a lot of fear and unknown of like their family members, or if they are trying to get their family members here, like when that's going to happen, the urgency, the feeling of urgency, and things like that also.
Thanks, Briana. I wondered, so far we've been talking primarily about challenges, problems, stresses. I'm wondering if you can each tell us a little bit about either work that you've done or work that you've been involved with, work you've seen to respond to some of these stresses and challenges. We know we've seen incredible resilience and innovation among not-for-profit organizations in Canada and around the world in terms of really stepping up and responding creatively. So I'm wondering if you can each tell us about how, again, the organizations and communities you're working with, how they've responded to these new challenges. And Lubasoa, this time I'll start with you, since you had to wait so patiently at the beginning. What kind of responses have you seen that that you would like to see more of in Madagascar and perhaps other places as well?
Thank you, John. I think that the immediate work had been for us supporting the community first to face the pandemic itself by raising awareness on health measures and distributing masks, because at Centre Valbio, we have a health department. And then after fighting for being able to keep all of our activities running properly after all the weeks of lockdown. So now we are happy that we have all our programs, health, reforestation, environmental education, and the research back again.
Whoops, Madhu, what about you in Fredericton, in the immigrant communities? What kind of responses have you seen or been involved with that that you would like to see more of?
Yes, I think immigrant, of course, they have responded well. As I said, that some of the students who came, and isolation period, 14 days, they have to make arrangement. They didn't know where to go, 14 days to supply the food. And so things like that. And also the emotional part of it. They didn't know when they go after 14 days out on the road, in the housing, they couldn't even find a place to live. Where are they going to go from hotel to where? Because they couldn't see the place. And in Fredericton, especially, there is a shortage of the housing. For the one room, even or one house, there are 5 people are waiting for it. So this type of situation was very, very difficult. And I actually, one student came and I sent the food for 14 days in the hotel for him. And when then after 14 days, he didn't have a place where to go now after the hotel, where? So I say, okay, you come to my place. I have a room there because my children are all out. So he stayed a month and a half with me till we find the place. So these are the issue. Some communities came. It's not me alone. In our community, some people, when the student were in such a need, so they have offered their help. Sometimes they were cooking the food and sending there, or if they have no place for temporary, having them at their place or helping them to find the place. But the one thing I must address here, the racism. This is also, I think some racial minorities, they had a more problem finding the place. Or even with the children, if you have a child, no, you have, this will show you the place, but no, you cannot take this one because downstairs the people might mind or things. In the human rights, when we read, you cannot do that because they have a child, so they won't be given the place. So, and it was so expensive. New buildings are coming, hundreds of them, but their rent's time and a half. Some people cannot afford that much. So this is another issue, because we don't have a kind of access at the time going place to place or finding out, because everybody was, half of the things were closed. Sometimes you call them, nobody's answering your phone. So what to do in that situation? Another one point also I want to mention, immigration system. Some of the in our community, and I know the people, 2 years back they went India to get married. So they got married, or their parents wanted to come, they have got the visas or some little work they have to still do, apply for the immigration for the newly wed couple, wife or husband, whosoever, and they have to wait 2 years almost because those facilities were closed. Nobody was answering them. So they were separated for 2 years. Some of the parents were coming because some were having a baby or so they wanted the help of the family. They got that having trouble to getting the visa to be there in the right time. You know what people were sick, what I mentioned before. So this system has put a lot of barriers, but I am glad that community came together. Whatever as a community we can do, we have done. So in the big cities also, I hear they were cooking the food for hundreds of people who were in that situation. They were really desperate because restaurants were closed and you can't go out or some seniors home or the seniors. So it's a way the people were very helpful. And that is, I think, plus point we have within our own community. Either they are immigrant or non-immigrant. It's not, it's everybody. Whatever they could do, they offer.
Right. So enormous challenges, but also some inspiring stories of the community members coming together and really stepping up to support each other. Stacey, I wonder about the context of that you work in, where many people are isolated from their families, but there are also communities of migrant farm workers together. What kind of responses have you seen to the challenges that face that community in particular?
Thank you. Well, food insecurity has been a big issue that we've seen. Definitely, this is ongoing within the pandemic for migrant workers. And yeah, we do hear of migrant workers cooking together, taking care of each other, engaging in solidarity with each other. So those are some examples that we've seen. I talked about there are ongoing risks that face migrant workers who may be in a situation of abuse, and deciding to speak out is a difficult decision because there can be major consequences to that, including not being able to return back to that employer or on the program, which would have significant impacts on their families. Yet still, there are workers who do decide to speak out around these issues in a public way. So that's something that we've continued to see. And I would say, from our perspective as an organization, we do engage in support in a spirit of mutual aid. So that includes providing food support. We have a migrant solidarity fund where when migrants broadly are in a situation and an emergency situation, that this is one way that we are able to support. And we have seen community members come together to support these efforts by giving funds, which it's really nothing like this exists in the province for migrants. So it's pretty incredible. And, things from rent and food support, kind of in an emergency situation, are ways that we have been able to support. But more broadly than that, I would say is the ongoing movement where migrant workers across the country are calling for full and permanent immigration status, recognizing that immigration status is what is leading to inequality. As I mentioned, we talk about migrant workers being temporary, but there are some that have been coming here for 30 years. So they're definitely part of our communities, but not treated as such and not able to exercise the same rights as others because of that. It's not only migrant workers as well. It's really anyone with precarious immigration status is in a similar situation. So yeah, thank you.
Thank you. There's a question in the chat from Lloyd Dalziel that I think highlights another element of the politics and community responses to the COVID-19 pandemic. And I'm going to try and paraphrase it, summarize it a little bit to shorten it. But Lloyd is highlighting, reminding us of the COVAX initiative, the global COVAX initiative that Canada has, the Canadian government has claimed or has promised to provide much more support than it really has. And that's a similar story that we've seen from governments around the world that have pledged support to COVAX, but it has fallen short radically in the number of vaccines, the difference between the number of vaccines that were pledged and the number that have actually been delivered. So, kind of paraphrasing the question, I think it's Lloyd's asking for advice or suggestions from our panelists and the communities you work with on any insights or ideas that you might be able to share on, there are two questions. The first is on how small and medium organizations, nonprofits in Canada can more effectively advocate towards the Canadian government to invest properly in the COVAX initiative. But also, are there examples from the communities of people that you work with in other parts of the world pressuring their own governments, pressuring the global healthcare system, the WHO, Canadian government perhaps, to step up, to invest more seriously in vaccination around the world? So why don't we, it's two big questions. Why don't we start with the first one? Based on the work you do and the communities you work with, any suggestions on how we can pressure the Canadian governments to commit more resources to global vaccination work? Both in terms of practical strategies, but I think it also highlights how we talk about the global impacts of COVID-19. What are the kinds of arguments that we should use, and are there arguments that perhaps we should be avoid or be careful with? This time, maybe Lua, I'll start with you again, but a sort of outside of Canada perspective. Any advice that you could give us on how to advocate to the government of Canada to invest more resources in global vaccination work?
In Madagascar, especially in the area where I work, there had been questions, a lot of questions on whether the vaccination is good, and there was also, in response to that, there was also a lot of raising awareness, sensitization about having the vaccination. And in the area where I work, for example, a lot of people get vaccinated. And my suggestion will be, due to the vulnerability of the communities, a lot of communities here, especially the impact of the COVID-19 as well. Countries like Madagascar or any other African countries are relying to other countries that may have possibilities to support and to help. And it's the pandemic is something like global. It's not just for certain areas, and it's good for us to like help and support each other.
Thank you. Well, I want to turn to the others now and add another twist to this question. So in the Canadian context, we've seen I think a strong discourse or a kind of the argument that the Canadian government and Canadians should support global vaccination efforts. And the argument goes a little bit like, we're not safe until everyone's safe. We're not safe here until everyone in the world is vaccinated and protected. And there's an element of solidarity, I think, in that argument, but there's also an element of self-interest that, we need to vaccinate everybody else so that we can be safe. And the ultimate goal is to make us safe. So there's this element of solidarity, but I sometimes worry about the element of self-interest and putting ourselves first, that we're just vaccinating other people in other parts of the world in order to protect ourselves. Is that something you worry about? Is that, in some parts of the world, we refer to vaccine nationalism, of a kind of a me first or our country first, prioritizing our own citizens first, or people who are in Canada first. Is that something you worry about in how we talk about vaccination at the global level. Madhu, maybe I'll start with you this time in terms of how would you encourage small and medium organizations to advocate to the Canadian government? Are there arguments that you would make, arguments that you would avoid?
What I feel, I think what I have read in the Globe and Mail once, that Canada has sent a lot of vaccine which they could not use, or the date was expired, or they didn't have a service so anybody can use in a certain amount of time. They sent to some other countries where they need it the most. So this was a very good step has been taken from our Canadian government. Other thing, the message what as everybody we have to send to our government, that when the crisis come, don't just send the army there. This is not the things that just okay, like American. And how many countries, Afghanistan and Vietnam and wherever, any crisis or anything they feel, they will send immediately the army. And billions of dollars they have spent there. Look at Afghanistan, especially situation. Canada sent the army, USA and all that. What happened to that money and what happened to that? I think lesson what we have to learn, that effort, that money we should send to in this situation. We don't know what happens even tomorrow. Maybe not this virus, maybe some other virus, but policy matter. This is our policy. This is a humanitarian kind of service or ethic and human rights act. When we open the United Nations, the booklet, you will find help, help, help. How do we help? So this is, I think, the situation they all have to, every country sit together. I mean, in the United Nations, I feel that when they all get together once a year or some, they have to put this point that we have to learn something from this crisis, from the virus, what happened. So just don't prepare yourself, but the medical help or the some funds so the people for the food, sending the food to them or crisis time. So what is the human need that we have to look, for as a whole world, communities. So I think this is a not in one time, has to go continuous kind of a message or sending from what we learn from now. That's what I feel.
Thank you. I also want to thank Janelle Frail, who posted a link to a document from Global Citizen on, looks like it has strategies that may be a pledge for pressuring the Canadian government to invest more in COVAX. And we only have a few minutes left, but if there are other people, other participants in the audience who have questions, please feel free to share those with us. Or if you have resources that you want to share, please feel free to do that. In the time, I think we've got about 4 or 5 minutes left. I want to come to lessons learned, either both positive and negative. From the work you do, the organizations you're engaged with, are there other lessons? As I said, they might be positive things that you want to keep doing the same, or lessons of things to avoid, to not do. And maybe I'll ask each of you if you can try and summarize in a minute or so. What are your top lessons learned as we hopefully come out of the pandemic? This time, Briana, I'll start with you.
Sure. I think that just being innovative and being client-centered, that's something we're always trying to do at the Y Immigrant Center. But again, just like we don't have to do the way things were, we actually, as an organization, when the pandemic hit, we actually met and made sub-teams. So you might be doing your job and be part of translating the day-to-day announcements or tutoring kids who are at school. homeschooling and things. So I think just being innovative and strategic and really just like checking in with people and asking like what is the most urgent need. That might be a computer, or to get to a medical clinic, or to understand what's happening, or to create some sort of like support network online. So I think like being innovative is one thing, and then the other thing is just recognizing that during any type of disaster or global pandemic, that these issues that we're all naming, they already existed. So I think we just like even once COVID-19 is over, we can't keep talking about all these issues, like the issues that Stacey was mentioning, or the issues that everyone's mentioning about like status and racism and access to things. Like we need, and even domestic violence, we need to keep these conversations going, because they were not just because of COVID. And so I just want to like emphasize that. And the last point I want to say, this whole time we've been talking about challenges that a lot of like, particularly we were talking about newcomers for what I was saying. I just want to also say that during the pandemic, many of our newcomer clients were the ones who were creating initiatives to make masks, creating supports for the community. And I think often there's a narrative of like, how can we help newcomers? And I think it's important to recognize the challenges and gaps, but we also need to recognize that, and I think Stacey mentioned this too, how much they give to our communities as well. And we need to start listening, I think, a little bit better. So when coming up with initiatives to serve communities, listen and see like what they need, listen directly to who it's going to impact. They can have a say in what those are. And, an example was even when we were trying to raise awareness about gender-based violence prevention, we actually had newcomer young men create an awareness video around masculinity, because, and it's like, they were like, what better people to hear from is from men to men, and they knew what messages were clear and what would be important. So they did that. So yeah, I think those are some messages I just wanted to emphasize.
Mute button again. Those are great to hear. Thank you, Briana. What about you, Stacey? In the work you do, what are some of the top lessons learned? Both things you want to do more of, and also things you want to try and prevent going forward.
Yeah, I would say in broad terms that in general, I think Nova Scotians probably across the country, we really learn to rely on each other and to support each other, recognizing how interconnected we are. And, I think there was a lot of news even in Nova Scotia about, what impact is it going to have on farmers if the delay in migrant workers being able to come here, for example, and really just highlighting work that's usually invisibilized so much, just how important it is. Migrant workers contribute to our food system and our economy so much, give so much, and are such an important part of our communities, but there's ongoing inequality. And so just, I would say, just highlighted the ongoing importance around migrant justice, and just how interconnected we are.
Thank you. And Luva and Madhu, we've got about a minute left, so maybe I'll just ask you in 30 seconds each. Could you highlight what do you see as the most important lessons learned going forward? Madhu, I'll start with you.
You ask me?
Yes. What are the most important lessons learned from your experience going forward? And if you can keep it to about 15 or 20 seconds now, that would be great.
Well, from my office, the message is coming. You must have seen the red. But we are saying that probably some people believe this virus came from China. So the reaction for that was the Chinese community. They went through a lot of kind of attack, racial attack, discrimination. People don't stand close to them, and pushing the women on the street. And I think we all know that what happened. So there we need a public education. These generation, those Chinese, what we see, we don't know they are third generation or fourth generation children, or they are not coming straight from there. Even if they are coming straight from there, do we have a control on this situation? We have to work where we have a control on that situation. I mean, whatever happened, you think that any Chinese community, well, they're responsible for that or they had a control for that. So there, the hatred, that
I'm
attack.
going to interrupt you there, and so you're emphasizing more and better public education around
Yes.
anti-racism work.
Yes.
Luvasua, what about you? What top lessons learned that you will take forward from here?
Thank you, John. The impact of COVID-19 had been serious for people, but we should not forget that it can be serious for wildlife as well. And the lessons is a time to step back and reflect on what we can do better in terms of reaching our conservation goals. And one example is to reminding park manager about the importance of protecting animals as well, because we know that COVID can be transmitted from human to animals as well. So park manager are being strict to the fact of respecting distancing between animals and human.
Interesting. I had not thought about that before. Well, I think we are officially out of time. So on behalf of ACIC, I would like to thank all of the participants very much for engaging in this discussion. I hope everyone else has found it as interesting as I have. I'd like to, just before everybody turns off and goes away, I just wanted to turn the microphone back to Jennifer Snoot, who I think is going to give us some instructions on next steps. Jennifer?
Thank you, John. And thank you so much, Madhu and Lavusua, Stacy, for that incredible discussion. And John, I think you did a great job of channeling Oprah, as you had suggested. So it was such an interesting conversation, and I really wanted to thank you for sharing how COVID-19 has had impacts in Madagascar, New Brunswick, Nova Scotia, and though we don't have anyone here, we have members from PEI and Newfoundland working on migrant justice issues as well. The stories that you've just shared with us have been really inspiring. We've seen through your discussion about vulnerable populations have been disproportionately affected by COVID-19. You've talked about new Canadians, migrants, women facing gender-based violence, children, those relying on tourism for their livelihoods. And I think that actually impacts a lot of folks in Atlantic Canada as well. But I have really appreciated hearing about how your organizations and how you personally have worked to provide support and to advocate on behalf of those who are most affected by COVID. And it's been really inspiring to hear all of you speak. So thank you so much for sharing with us today.